Hi, everybody. Good evening. Welcome to Evoke Therapy Program's broadcast. I'm Dr. Brad Reedy. Today is Tuesday, October 10th, 2023. Tonight, I'm going to be talking about trauma and insecure attachment. I love this topic. I think that there are some incredibly practical applications, both to parenting, but also to our own work, which, of course, is the foundation of our parenting. Before I get into that, I want to make one announcement coming up at the end of this month, actually at the beginning of next month. My daughter, my wonderful daughter, Emma Reedy, is going to be hosting an all-day intensive workshop for young adults. So if you've worked with Emma, you know she's marvelous. If you've heard people that have worked with her, you know she's marvelous. And you know me, and I tell you she's marvelous. So 10 a.m. to 5 p.m. in New York City, November 4th. If you're interested, contact Becky at evoketherapy.com. That's BECCI at evoketherapy.com to learn more. Should be a wonderful day. With that, let's get into tonight's subject. Gabor Mate said, trauma is not what happens to you. Trauma is what happens inside of you as a result of what happens to you. And that's really what I'm going to be talking about tonight. The most, I think, difficult thing to think about for most people is the vast arrangement of situations and circumstances that they cannot control. Right? You can't control what happens to you on a daily basis. You don't have the absolute control over that. And maybe more tender to our hearts, you can't really control what happens to your children. But what you can control, of course, is how you respond to that. And by control that, I don't mean that you can simply will yourself to be different immediately. I've talked about this before, that the result of deep work, of sustained work, is not what you get, but what you become in this process. So tonight we're going to be talking about the foundations of attachment, what attachment is, how it's developed, if, or maybe I should say more appropriately, to the extent that we didn't develop in a situation where we experience a secure attachment, what then are our choices left over? How can we cope with that? How can we deal with that? I shared with this, along with this quote, the title of a journal article that I published. Actually, my professor published it as a result of my dissertation 15 years ago or so. And the reason that I share that is because long before I understood attachment, I was writing about this, mostly because my professor was interested in the topic and asked me to do it. But it's this idea that it's not what happens to you that really becomes the defining variable in your life. It's not what happens to you, but it's how you process it. And how you process it in a very, very large and significant way is dependent upon the attachment, the base that you're operating from. That is the relationship that you have with your parents. So I talked about in my dissertation, and subsequently in this journal article, about this idea. We looked at the research, and we looked at children of divorce and children that came from at least one alcoholic parent. And when we looked at all the data, we found that there was one powerful group of mediating variables, something that was able to mitigate the effects of the trauma. And it was that somebody that was consistently in the child's life who saw them. If they answered that, if they answered positively to those questions, those small group of questions, we could not tell the difference in terms of the outcome variable, whether or not they had divorced parents or whether or not they had an alcoholic parent. In other words, it overshadowed the events, the uncontrollable circumstances in the child's life. And that's the hope for tonight, is that you can't control not only the past, of course, but you can't control going forward the circumstances that befall your children. But what you can do is you can provide them a safe base of operations, a safe place to go, a resource to help them process and deal and integrate whatever happens to them. And that thing that you provide for them is you. Through sustained effort and practice and work on your part, you can learn to regulate your nervous system. I'm going to talk today about the difference between state anxiety and trait anxiety. Over time, you can develop a state, if you will, of calm, of serenity over time, so that when your children come to you, or anybody for that matter comes to you in crisis or in distress, your nervous system being regulated, you're capable of being there for them and helping them soothe, helping them make sense of it, helping them learn how to respond and integrate the experience into themselves so it doesn't become a problem that festers and creates symptoms. So I learned about that, or was studying about that, long before I had an idea about the depth and the breadth of this work on attachment theory. And of course, Gabor Mate, one of the most popular writers today on trauma, speaks to that idea when he says it's not what happens to you, but what happens inside of you as a result of what happens to you. John Bowlby is considered the father of attachment theory. And he looked at and defined basically four. I'm only going to talk about tonight three areas, or three descriptions of the way that we bond, and the way that our parents attach to us, or we attach to our children. And he talked about this idea that there's a safe haven, right? That's the core, that the child feels, when the child feels threatened or afraid, he or she can return to the caregiver for comfort and soothing. They become this base of operation from which they go out and explore the world. We can see it in toddlers, right? Infants, the small children who have the capacity to move around. We can see that the child looks back at the parent, and they're sensing from the parent what is safe. It's that same experience that so many parents can relate to. When your child is outside playing when they're young and they fall and they skin their knee, they look back at you to see if they are okay. So the child begins to make sense out of themselves by the way that we think and feel about them and about the situation. The caregiver provides a secure and dependable base for the child to explore the world. The child strives to stay near the caregiver, thus keeping the child safe. And when separated from the caregiver, the child will become upset and distressed. A secure attachment means that they can venture as they grow and develop. They can go farther and farther away, and eventually, of course, go as far away as they need, the other side of the country, the other side of the world, and they can retain that sense of safety that they inherited, that they internalize. My therapist years ago said it's like you carry a copy of the parent around inside of your head, inside of the psyche, and you carry that around with you. The three types of attachment that I'm going to refer to, and there is a fourth that's disorganized, that is very, very rare, but is the secure attachment. I typically talk about secure versus insecure, or anxious, excuse me, secure versus anxious. The characteristics of secure attachment include this: secure attached children exhibit minimal distress when separated from caregivers. Remember, these children feel secure and able to depend upon their adult caregivers. When the adult leaves, the child feels assured that the parent or caregiver will return. When frightened, securely attached children will seek comfort from caregivers. These children know their parent or caregiver will provide comfort and reassurance, so they are comfortable seeking them out in times of need. You know that image, or that idea that I share with you, that if you come to the child, or excuse me, if the child comes to you to share something, to confess something, and you respond with an audible and an invisible gasp, the thing that the child knows is that you're not a safe person to rely on. You're so afraid and anxious, reactive, that you can't be relied on for a safe place to make contact with. You can't be relied on for the child to soothe themselves. But the strangest thing about this is parents experience, through their own conditioning and teaching from their own childhood, they experience this fear feeling response as love. I hear it talked about all the time, that anxious parents or codependent parents are just those parents who love too much. And that's not true at all. There's no such thing as loving too much, right? The minute that it starts to be too much, by definition, it becomes something else. And that an anxious response to a child's distress or mistake or difficulty, right? We're all going to experience some of that. That's human. But overall, that kind of pattern of response to a child's dysregulated nervous system, upsetness, starts to give the child a sense that the world isn't safe, that there's no place to go for safety, for cover. And that the things that they tend to seek out over time to bring themselves comfort are things like the symptoms that we associate with mental health disorders or addictions. They're looking for that sense of regulation that they can't get from mom and dad because mom and dad are too triggered. Mom and dad's baseline of calmness is such that they can't rely upon them as the secure base. And there are two kinds of what we would consider unhealthy or underdeveloped kinds of attachment. The first one is ambivalent attachment, anxious ambivalent. Ambivalently attached children usually become very distressed when the parent leaves. The attachment style is considered relatively uncommon, affecting approximately 7 to 15% of U.S. children. Research suggests that ambivalent attachment is a result of poor maternal availability. I want to just pause for a moment because the language is going to be very, very sexist. So most attachment theorists will talk about mothers or functional mothers. More and more often, they're talking about caregivers or parents. But that's the history of this field, and it's justified in a sense because in the recent history of human development, it was for the most part the mother's job responsibility to take care of young children while men went out and worked outside of the home. That's changing, of course, I know. And there is definitely a bias in the research and in the history of attachment, but fundamentally, we're talking about the functional parent, the one who's in charge of primary caregiving for the young child. Anxious avoidant attachment. Our children with avoidant attachment tend to avoid parents or caregivers. When offered a choice, these children will show no preference between a caregiver and a complete stranger. Research has suggested that this attachment style might be the result of abusive or neglectful caregivers. Children who are punished for relying on a caregiver will learn to avoid seeking. This sometimes this is a painful thing to share, but oftentimes when I see in my experiences casually, socially, when I see children that are developing this avoidant attachment style, a lot of adults will look at that and say, look how self-sufficient that young child, baby, toddler is. They'll frame it or think of it in terms of a positive thing. And over time, of course, it causes less stress. The parent is more free to move about, doesn't have to attend to the child. But over time, again, this child has no safe harbor, no place to go to soothe themselves. Most often, even though I study attachment-based therapy constantly, I talk about secure versus insecure, secure versus not secure attachment. And I don't really mind the style. I don't pay a lot of attention to the style. I know a lot of people get really fascinated and interested at discovering whether somebody's ambivalent or avoidant. To me, that's just the icing on the cake. That's just the superficial. The fact of the matter is it secure or is it not secure? Harville Hendricks, a great self-help writer, said, "We are born in relationship, we are wounded in relationship, and we can be healed in relationship." I think this is probably the worst news that I have to tell you during this broadcast, that the healing, the healthy development, the reparative work that everybody must do if they are to evolve and to grow, to become larger, there is no shortcut, no hack. I know that clients and therapists are always looking for some quick technique. But the fact of the matter is, human beings develop in a unique way compared to other animals. We spend more time, more reliant on our caregivers by a long shot than any other species on Earth. And there's great news with that because our brain continues to develop during those first 20, 25 years or so. And because of that, we can develop complex neurological capabilities, right? That's the one thing that we have advantage of because of this long period of parent-child interaction and dependence. But what that means is where there are injuries or lapses in development in this attachment process, it takes a significant amount of time. Now, the good news is if you can't afford therapy or you can't find a therapist, that there are groups all over the world meeting every day, several times a day, online and in person, that provide an experience where you can go in and talk about yourself and be welcomed. Those are 12-step groups: Al Anon, Codependence Anonymous, Families Anonymous, AA, Adult Children of Alcoholics. And don't be confused and put off by all the labels of those groups. They're just creating a context where people get to come and be themselves. In other words, confess who they are, show up as they are, and the group welcomes them. The old timer in the group says, "You're in the right place. Sit beside me. I've done everything that you've done and more. And you're in the right place among the right people." So we can find places where we can be accepted. I walk around in the world and I notice how rare it is that what I think and what I feel, not just me, but everybody, what people think and people feel is something that so many people instinctively think it needs to be fixed, think that people need to be taught the right way, that there's this urge from human beings that I experience in all contexts, except for, of course, in therapy, in all contexts except for therapy, where people think they need to correct people and teach them the right way to think, the right way to feel, the right way to be, the right way to operate in this world. And this idea of healing a relationship is the opposite, is being welcomed as you are, finding a safe place. Mental health is less about getting better, so to speak. It's definitely not about becoming good. And it's more about making peace with your humanness, with your human self. It's this idea that who we are as humans is enough and okay. It's worthy of connection. We're worthy of love. We deserve acceptance in this world. I've shared the experience that if I go out and just tell somebody that I don't like a movie or I don't like a certain food, virtually in almost all circumstances, people will try to talk me into something different. In in attachment and in reparative work, therapy, psychotherapy, it's different. You come to me, you come to the therapist, you come to the group, you share your experience, and somebody seeks to understand your perspective, seeks to see the world through your eyes, and essentially says to you, it makes sense. Where you come from, it makes sense that you would think and believe that. I understand. And that experience is what we're all seeking for, that experience of being known, of being seen, of being okay. So in Evoke's approach, both our intensive program and in our wilderness program, this becomes the foundation of the work. Both the way that we respond to you all, to your children, to your families, and the kind of work that we seek to do on our own. I was speaking at a professional conference last week, and I was supposed to be talking about the current state of the field. That was the topic of the panel that I sat on. But as I thought about it and sat there, I thought, and when it came to my turn, I just said to the entire group of individuals, 250 or so people in the room, I just said, you have to go do your work. The same thing that we ask parents to do. You have to do it because you can't take anybody farther. If you haven't made peace with the parts of yourself that you were told were unacceptable, if you haven't made peace with all those parts, how can you welcome somebody else? How can you even have experience with that process? So we're born in relationship, we're wounded in relationship, and ultimately we're healed in relationship. And that takes time. There's no quick fixes. And the audacity to be you, I wrote, to heal, therapy clients must re-experience themselves in the presence of an empathic other. This will create the self-compassion in the client required to expand self-awareness. In other words, if I come in and confess my symptoms, my secrets to the therapist, and he or she or they accept me, I can learn to accept myself. And then by accepting myself, I can work on it. But if I fear rejection, if I fear judgment, if I fear that I'm going to be told that there's a right way to think and feel about the situation, I'm going to hide that. Not just from the therapist, but even from myself. A compassionate response from somebody else, from a non-judgmental other, increases my self-awareness. So often in psychotherapy, what I'm looking for is for the person to recognize, to give voice to the thing about themselves that they were told was wrong, bad, or unacceptable. I'm codependent. To use a very simple example, if somebody comes to me and says, I know that I struggle with codependency. I know I struggle with setting boundaries. I failed at it again this week in my life in these relationships. My response often is, that is so amazing. That's fantastic that you see it. Most of the work is done in just being able to see yourself. And that seeing of yourself starts to heal. That's why psychotherapy is so fundamentally different from most people's original contexts. Most parents are anxious, that includes me, are anxious for our children to avoid pain and hurt and sadness and difficulty and sorrow and mistakes, right? Because of our own lack of a secure attachment, we're trying to control the child. We need the child to stay away from danger. And we communicate that in our presence. But really, psychotherapy is a place where you go and you ultimately, it's sort of like confession. You confess who you are, just like I said with the 12-step groups. You confess who you are, and what was once bad at home is now nothing. Is now something that somebody's just curious about to understand and dig deeper. The end result of all this work, as Freud suggested, was the goal of therapy: freedom. Freedom from unconscious obligations. A lot of times people hear me saying should when I don't. Sometimes somebody says, well, I think I should quit my job, or I think I should get married or get divorced, or bring my child home or send my child away, whatever the big life decision is. And my response is, well, you could do that. You could also do the opposite, or even something in between. But because of our program, because we're so accustomed and expecting somebody to tell us what to do, people hear me say what you should do, which I did not say. My response is, there's a whole host of options here. And if the discovery of who you are is the goal of therapy, as I think it is, not who you should be, not the right or the good version of you, but who you are, it's going to be a messy process. You're going to make mistakes. And I'm going to be here with you for that. And if it takes years for you to ultimately heal, I'm going to be here as long as you want me to be here, walking beside you on this journey. And what I've learned as a client in long-term therapy, that because my therapist could sit beside me for years in my own, part of me wants to say idiocy, but that can be very triggering for people. My own humanness, my own fallibility, my own imperfectness. Because she could patiently sit beside me, I now can sit beside me. I'm more capable of admitting to a mistake in my marriage than I used to be. I'm less averse to denying it, to creating a story where I was the good guy and not the bad guy. Because somebody showed me that was okay by the way they responded to me. That's the attachment experience. Dr. Gill says the experience happens to be my therapist and a fantastic, prolific writer. She says the experience of seeing one's base from a different perspective can be profound. One way this happens is by allowing ourselves to be honest and open with someone who does not react the way our parents did. For example, what was very bad at home is now nothing. This difference in experience allows for the realization that things could be different. One's assigned position in one's past is not necessarily one's assigned position in the universe. I coach people, when you go to therapy, if the therapist has advice for you on the right way to do things, find another therapist. And tell the therapist on your way out the door, you already have parents. You don't need another one. If the therapist's agenda or anxiety for you to improve or get better is at the forefront, you can't be yourself. And I know that might sound confusing and like I'm suggesting that we don't make progress in psychotherapy, but it's just the opposite. It's when there's no pressure to make progress in therapy, especially if that pressure is coming from the therapist themselves, that we most often make progress in therapy. But if the therapists need to be a good therapist, relies on how well their clients do, which I think when we all start off, we feel that way. I'm going to say that again. If the therapist need for the client to relies on the client to do well, to make progress, so the therapist feels good about themselves, you've entered into a relationship most likely much like the context that you grew up in. But if the therapist has done their work, has developed the wherewithal through their own practice, their own work, to just be there for you, and part of it is because they understand how difficult it is to be a human being. They're in constant contact with that sense in themselves. That patience, that non-judgment, that non-anxiety creates a safe context where you can explore without the pressure you felt as a child to take care of your parents. It's important. I've said this recently. My daughter, my youngest, she has a teacher that she has a strong affinity for at school, and through discussions that they've had, it's a sociology class. They're asking if I'll come in and talk to the class, the high school class, about mental health, mental illness. And of course, I agreed. And as I thought about it, after I said yes to it last week, I was thinking this is going to be a difficult conversation. I can easily imagine me speaking to children about mental health, knowing what I know about child development and the impact of parents and their work on the child. I can easily imagine children coming home to their parents and saying, well, this therapist came in and basically said it was all your fault. And that causes a whole lot of problems. And as I was sharing this concern with my adult daughter, the one who's running that intensive later this month or early next month, she said to me, Dad, what you will tell them, of course, she knowing that I know this, she said, what you will tell them is that what happened to them wasn't their fault, the children, but it is their responsibility to deal with it. So it's true. We were all dented. We all were affected by our limited, imperfect human parents, some more than others, some less. And everybody, as a result of that, has some mental illness in them, not necessarily rising to the level where it becomes a diagnostic code, right? A large percent of the population have a much less severe version of mental illness or lack of mental health, I should say. But ultimately, it's our responsibility to work on it. And if we don't, if I don't sort out my anxiety, if I don't sort out all the things that I'm talking with you about today, I will put that on my clients and my children. I will need them to show up, to develop, to be a certain way, to be a certain level of health and make a certain level of progress so that I feel good about me. And I repeat that pattern, that intergenerational pattern. So attachment starts with your work, period. And I think a lot of people miss that. So many people are so motivated to love and care for their children. I know I am, that they hear about attachment theory and attachment work, and they're like, how can I be there for the child? And yes, that's true. But first, you've got to be there for yourself. You've got to do your own healing. You've got to let go, do battle with your own guilt, your own shame, your own ego. Because if you don't, the child will bear the responsibility, bear the burden of it. And when they struggle, as children do, because they're human, and the parent seems and expresses the torment of a loving parent watching a child struggle, the child will feel, on top of what they're already struggling with, a great deal of guilt and shame, an added burden to what they're already carrying in their life. Therapy is a place we go to receive a different response than the one we received in our earlier contexts. to be received completely and entirely. An adequate therapist responds to our warts, our wounds, and our symptoms with calmness, understanding, patience, and curiosity. This therapist is not anxious to fix us, but rather is passionate about finding us. Big difference. And when we are found and seen without the anxiety, frustration, or disappointment we experienced in our earlier contexts, we come to believe that we are okay. We're able to look deeply into ourselves, into our wounds and our traumas with compassion and understanding, and we heal. I'm going to spell it out through these next slides in as clear and concrete way as I can. First slide. We feel safe when we are around somebody safe. Attachment theory explains that this sense of safety can be internalized over time and essentially become permanent. When caregivers can consistently and do consistently provide resonance, safety, and security, regardless over the circumstances, the tragedies that befall children. When the parent is regulated and calm and capable, the child develops this internal base of safety that they can carry throughout their life. The result of this experience that I've just described is a secure attachment. If it didn't happen in childhood, we call it an earned attachment. Happens later in life through therapy or some other process. It's a sense that one is home, that what one is seeking for is themselves. It's safety, it's security, it's the feeling of I'm okay. And poets and prophets, artists refer to this feeling as heaven, nirvana. Not a place up in the clouds that exists, but it's here and now through this experience. It's a transcendent, powerful feeling that I think that people are seeking for when they ingest drugs or any other thing that increases dopamine. That sense that I'm okay, that everything is okay, everything's going to be okay. Secure attachment in childhood or earned attachment later in adult life with a therapist, it's when you are seen by a person. You don't spend the rest of your life trying to be seen by every person. If you get seen by somebody enough, and believe me, I know this because the opposite happened to me for most of my life. If you don't get seen consistently enough, you spend your entire life trying to be seen by everybody. So this selfie generation that people are so happy to be critical of because they haven't looked at themselves and their own narcissistic wounding. If it's true that the selfie generation exists, and I don't like that language because it feels derogatory, but for the sake of this discussion, if it exists, all we're seeing is people who are looking to be seen, looking to be seen as significant and important and worthy of connection and worthy of love. And yet we have this disdain for somebody who posts a bunch of pictures on social media of themselves. We punish people. We punish children by saying that self-esteem is an inside job, that you have to pull yourself up by your bootstraps. We tell children the lie that it's only what they think about themselves that matters. That is not how Homo sapiens develop. Homo sapiens develop with a caregiver, ideally, who can see and respond to them. And through that experience, they have this sense, this felt sense that I'm okay. So when people get upset with them or when trauma befalls them, as it will inevitably happen in their lives, big or small, there is this baseline feeling, lived experience that I'm okay. Gill says, in many ways, a good therapist is the parent who you did not have. And psychotherapy is the childhood you did not have. As Kohut thought, the goal of psychotherapy was to become an ordinary, suffering human being. My goal in psychotherapy is not to fix my clients and to make them better and wonderful and amazing. My goal is to regard their humanness as beautiful and enough. Because if the goal is to be good, you're going to ward off any mistakes, any fallibilities, any issues that you might have. But if the goal is to be human, and if that is realized, then when you make a mistake or trip up or hurt somebody that you care about or fail, The accountability is easy because it doesn't threaten your sense of value, your sense of worth, because of that secure attachment. You're able to tolerate pain and distress. There's research that shows us that people with a secure attachment need less pain medication after surgery. That makes sense, doesn't it? There's a chemical need. I tell children when I visit them in the wilderness, the drug, that feeling that you get, think about alcohol. Most people have experienced alcohol who are listening to my voice. What does it refer to? It's referred to as liquid courage. In other words, it takes away the fear, the anxiety. One of the reasons why MDMA works so well for the purposes of psychedelic assisted psychotherapy for anxious people is because it chemically changes the brain so that the circumstances, the people around them aren't threatening. And over time, that psychedelic assisted psychotherapy can become permanent with the assistance of a therapist. Now, this is the implication for parents. Research suggests, if you want research on this, Parenting from the Inside Out is a great source. Daniel Siegel, Mary Hartzell. Research suggests that children who have had a positive connection with in life have a source of resilience for dealing with life's challenges. If you want to know how to foster resilience in your children, it is by creating a secure attachment. And what is required for a secure attachment is for you to unravel your own life, your own history, your own trauma. Siegel and Hartzell say, as a parent, making sense of your life is important because it supports. This is it. This is everything. As a parent, making sense of your life is important because it supports your ability to provide emotionally connecting and flexible relationships with your children. Having a coherent sense of your own life history enables you to offer the kind of experiences that help children make sense of their own lives. You don't become reactive, fight or flight. There may be other times when we may become aware of being filled with sensations that we cannot name or understand logically. It is an experience. It's not something that is told to you. Furthermore, Siegel and Hartzell explain, here again, the important point is that not what happened to the individual by itself that matters. It is how the person has come to process those events. Having some supportive connection with another person may help to make sense of difficult experiences in the home, not because of the wise lecture. And I think that's what most of us think good parenting includes a lot of. At least I have thought that in my past. Sometimes I fall into that same mistake now and again today. But it's a regulated nervous system. It's a calmness. It's a sense in the parent that everything is going to be okay. But when we're constantly looking to the future and projecting out all the horrible things that are going to happen, no matter what comes out of our mouth, the child has the experience that the world is not a safe place. There are great risks and the stakes are tremendous. When parents understand that they can let their children have and express their desires without having to fulfill them, it frees the parent to make a connection to the child's experience without having to deny their feelings. I'm going to read that again. When parents understand that they can let their children have and express their desires without having to fulfill them, it frees the parent to make a connection to the child's experience without having to deny their feelings. The child just gets to be who they are, feel what they feel. And furthermore, all parents and therapists fail at times, some more, some less. But some parents and therapists cannot maintain a balance of mind, and failing, the parent becomes a container that is either too rigid, too reactive, or too fragile, falls apart, can't handle it. A rigid mother takes in and utters formal responses without a real understanding of the infant's distress. A fragile parent will, when confronted by her distressed baby, go to pieces and panic. In either case, the infant receives back its own projection with the implicit message that, after all, as it fears, its state of mind is not tolerable. It suffers, in Beyond's terms, a nameless dread, a state of mind that is unthinkable. So if I show up and my mother, father figure, as a young child, I show up and they get overwhelmed by it and they fall apart, I am bad. That is why it's so vitally important that you manage your own anxiety. My daughter said to me, are you going to tell the kids when you speak to them in the high school that most likely at least one of each of their parents has an undiagnosed anxiety disorder. And I said to her, I'll find a way to weave the idea in where I can without removing the child's responsibility to still make something of their own life and to heal themselves. Parental anxiety is experienced by the child as something is wrong with the child. And since we all struggle with fear and anxiety sometimes, the goal isn't to not be afraid and to not be anxious. The goal is to own it. And by owning it, that means you go to your meetings and you go to your therapist. I said this to the professionals last week. I know this is going to happen someday. Virtually everything that I've thought was going to happen up to this point in the treatment field has happened. And eventually it's going to be common knowledge that the best way to help children is to help the parent. And that if we can get parents to come to the intensive program, to get a coach or a therapist or go to 12-step groups, if we can get them to do that, if we can remove the barriers, the fear, the anxiety, the guilt, the shame, all the barriers, and get them to embrace their own journey, they'll be more capable of being there for the child. It doesn't mean that the child will have no issues and no problems. Children are human. It means that the parent will develop a greater capacity, a largeness of soul, I like to say. They will become a capable container, is the analytic term. And when the child is in distress, the parent won't fall to pieces. The parent will be capable of responding flexibly from the top part of the brain, because their bottom part, the part that stores the emotional functioning part of it, the fight or flight part of it, it is not hijacking the brain, because the parent has developed that neurobiology over time through the experiences that I'm describing. I wrote this in the book, the Audacity Be You. It's up on the wall at our program. For those who want to know practically what it looks like and sounds like, I said this to somebody today. When I do intensive work with individuals, and I have people go back in time travel, and go back to their parents around the time that they themselves were a young child, 10 years old, 8 years old, 12 years old, and tell that parent in a role play or an empty chair, tell that parent what you need to tell them. Say whatever you want. I ask the individuals in that practice sometimes, what would be their ideal response? What would be the best response that you could imagine? And because people have so few experiences with secure attachment, they can't even imagine it. It usually sounds like a lecture, or telling the child that everything's going to be fine. Or maybe even that the child is overreacting. But here's what it sounds like. It's not the words, it's the feeling behind the words. It sounds like this. Thanks for telling me. Tell me more. I really appreciate knowing what you're saying. I'm glad you told me. Thank you. That sounds hard. I'm so sorry. I'm here. I'm listening. You're not alone. That makes sense. Is there anything I can do for you? You must have a good reason for what you've done. I'd like to understand. What can I do to support you, or I can relate? What it doesn't sound like is, that's silly. That's irrational. That's unreasonable. Ridiculous. You're overreacting. You're too sensitive. You're scaring me. You're being selfish. You should, and then fill in the blank. Don't pay them any mind. They're just jealous. Ignore them. You'll get over it. Look on the bright side. And my personal favorite, why did you do that? Even though the words sound like a question, it's really just a shameful message. Have you tried this or that? Or that's just your depression, your insecurity, your anxiety, your narcissism, your defense, your justification. Safety is capable. Safety attachment work is based on our own attachment work. And there's a direct link. We know this very, very clearly, and I say this consistently, that the greatest contribution you can make to your child's well-being, the greatest contribution you can make is a secure attachment, which is a safe, secure, welcoming, capable, regulated nervous system response, flexible response. That's the greatest thing you can do for your child. It's better than anything you can teach them. And the research is consistent across cultures, socioeconomic statuses, all the other variables. It's consistent. A secure attachment is the greatest contribution. The greatest predictor of your ability to provide that secure attachment is how much work you've done. What's not a predictor of your ability to be a good parent is how good or bad your childhood was. And that's the surprise. So if your response is, well, I had a pretty good childhood, my parents were pretty reasonable, that's a great start. I'm really happy for you. But it's, have you made sense out of it? Have you looked at it critically? Do you understand what you were taught? Do you understand your conditioning? Do you understand your unconscious assumptions? Do you know all the shoulds and the shouldn'ts in your head? Have you deconstructed guilt that you've been conditioned by? That's the work that if you do, the connection to yourself that you do with a therapist, a capable other, that's the foundation of your ability to provide this for your child. And if you can't do it, you find somebody who can do it for your child. That's why I get help for my children, because sometimes I'm compromised. It's not that I haven't studied this stuff, but part of what my education has taught me is that sometimes I'm not the best person. I am triggered. I wrote this next slide more recently. I've shared it with you a couple of times. I love this next slide. It talks about our ability to listen based on our capacity. And at first I just had steps 1 through 5, right? Step 1 is you just stay quiet. If nothing else, just keep your mouth shut when someone's sharing something with you. That's the minimum, I thought. Number 2 is, minimal encouragers. Yes, I got it. Nodding eye contact, right? Letting them know that you're listening. Level 3 is reflective listening, engaging them, asking questions for clarification, reflecting back what you've heard to check out if you got it right. Level 4 is empathy. I understand. That makes sense. I can relate to you. And of course, level 5 is accountability. I'm sorry. I did do that. You're right. You're not imagining things. So I listed these 5 levels of listening by capacity. And then somebody asked me wisely, but what if you're not in a place where you can't hear? And then I realized there has to be a 0 on this list. Because sometimes you can't listen. Sometimes you're not regulated. So you have to say to the other person, I can't hear you right now. I need a timeout. But that's really hard for us because that requires us to own our humanness. And Brad Reedy, I want to be good. I want to be capable. I want to be a role model. I want to be great. I want to be evolved. I want to be enlightened. I want to be wise. And all of those wants fly in the face of who I am, which is I am sometimes those and I am sometimes the opposite of those and sometimes in between. So the work is, mom and dad, own your stuff. Like Carl Jung said, the unlived life of the parent is the heaviest burden, the greatest burden for the child to bear. Last week at this conference I was mentioning, somebody asked from the audience the question, we know that the old saying that the sins of the parents, the sins of the fathers are felt on the heads of the children. And I said to them, that's a phrase from mythology that refers to this Jungian idea that if you don't do your work, your children will be left with that work to carry. And if you do your work, your healing is contagious just like your trauma is. Like my daughter Anima said to me about 6-8 months ago when I was complimenting and just observing how much farther ahead that she is than I was at her age, than most people are at her age and many years to her senior. And usually she just says, thank you. And this particular evening, she said, yeah, Dad, that's true. I might be farther ahead than you, but I didn't start this. You did. And then I realized she's right. Really, my mom started it because my mom did get us into therapy and did remove the stigma for therapy. And because of that, I got into therapy. And now my children are raised in it. My son just said to me, my 30-year-old son said the other day that I was speaking at his work about mental health. And somebody next to him, he was just listening to what I was saying, and it was just kind of going right through him. And his friend standing next to him during something I said, "Oh my gosh, that's amazing." And my son looked at him like, "Oh, doesn't everybody know that? I've heard that my whole life." So the healing that you do, mom and dad, gosh, I hope you can find the courage. And that's really what it is. That's why it's the journey of the heroic parent, because it's the willingness to do your own work. It's the willingness to look at yourself and your contribution. If you can do that work, or to the extent that you're willing to do that work, your healing will ripple and reverberate throughout all eternity to your children and to your children's children. And the issue here isn't their symptoms, isn't whether they're using cocaine or cutting or skipping school. That's not the issue. It's the connection. That trumps everything. So whether the take homes, your work is the foundation of a secure attachment with your child. That as you do this work and rewire your brain, that you are more flexible in your responses. Siegel and Hartz will talk about the high road versus the low road. The high road isn't some moral ground. The high road is the top part of the brain, the thinking, the problem solving, the creative part of your brain. The low road is the fight or the flight, the limbic system, the amygdala, right? The first part of the brain that develops, the oldest part of our brain, historically speaking, often referred to as the reptilian brain, because that's all the reptiles have. But what makes us unique as Homo sapiens is we have this prefrontal cortex. And if we can do our healing, we can respond to circumstances, situations, trauma, and stressors flexibly. Connection trumps everything else. And it's the only thing you can control. You can't control if your daughter or son get assaulted sexually. You can't. You can't necessarily control if they have a learning disability and they experience severe anxiety in school. You can't control the organicity of their nervous system, their sensitivities. But what you can do is develop a bigger and bigger capacity to be there for them. And because our children, those listening to this broadcast, watching this broadcast, have children that are struggling with mental illness and addiction, it is incumbent upon us that we go and do our work, right? As I always say, go do it over there so that when you come back to your parenting relationship, you can be there for the child instead of requiring them to be there for you. In a sense, that's the issue with marriage, too. You go to get healed and happy, and you come to the marriage happy instead of begging for the partner to fill your cup, begging the partner to make you happy, taking all the projections, all the unfulfilled dreams of your childhood and projecting it onto your spouse and asking it from them. Instead, you go out and take care of yourself, and you come to the marriage happy already. And you make a decision to walk your individual path together, supporting each other as you can to get where each of you need to go. Pay attention in your parenting more to the attachment than managing behavior. Sometimes we have to do behavioral things. That's a part of it. But fundamentally, primarily, the foundation of this house is the attachment and the connection, not the behavior. And this starts with the connection to yourself. The reason I'm less judgmental, and I still have some ways to go, the reason I'm less judgmental now than I was 20 years ago is because I've come into contact with myself. And I either have to hate myself and everybody else, or I forgive myself. And thus I can forgive people who carry around the same characteristics or traits. Anxiety is contagious, but so are regulated nervous systems. Over time, state anxiety is something that everybody experiences under moments of stress, right? The state that you're in. Trait anxiety is the baseline of anxiety that you carry around. And that's mostly what I'm talking about tonight. In any given situation, anybody can be brought to an anxious sense of themselves, an anxious sense of the world. But what I'm talking about is this core baseline that runs through our lives. And state anxiety, if repeated and exposed to over time, is lowered than trait anxiety. That's another way of describing the attachment experience. If we spend time around safe people, we eventually feel safe and carry that around with us. It becomes contagious. And lastly, the unowned parental anxiety is essentially the common cold in mental health. If we don't take responsibility for our own serenity, as they say in Al Anon, if we don't make our serenity our responsibility, we will inadvertently, unconsciously ask the people around us, our children and our spouses, to carry it for us. All right, folks, I hope that was helpful. I hope that makes sense, and I hope that's a nice point of contact. If you want to read more about this, both of my books, The Journey of the Heroic Parent and The Audacity to Be You, speak throughout about the idea of secure attachment and to do our work. Both of my books are available on Amazon and Audible. Our next available intensive, there's still a spot left if you want to, last moment. We have a spot open at our October 18th through 22nd intensive. That's next week, about 9 days from today. Contact intensives@evoketherapy.com to learn more. We also have an online version of it. Our next online version is November 10th through 12th. Like I said, we have the young adult intensive that Emma is running in New York City, November 4th from 10 to 5. If you want the sequel to Returning to You, to Finding You, we call that sequel Returning to You. The October intensive is full, and the March group is filling up already. And then, of course, I have a Finding Connection workshop symposium that I'm going to be running again on February in February. Excuse me, no, that's something different. The one that's listed here, the Finding Connection workshop, is I'm going to be hosting 4 couples at our intensive program and going through the Finding You family of origin work. So if you want to do your work alongside of your partner, I believe, what I've come to believe is that falling in love, being in love with my wife and her with me, is in part falling in love with her dilemma. I have to learn about her dilemma and learn to love it, not hate it, not want it to be better, not try to fix her anxiety or her mental health problems and vice versa, her to me. But I have to understand it and have compassion. Then I become part of the solution, not another person who needs her to feel, think, and be a certain way so that I'm okay. We have custom programs for couples and families and co-parents. Contact, like I said, intensives@evoketherapy.com for more information. We have support groups for wilderness, current, and alumni families. The next offering is October 12th at 7 p.m. Mountain Time. If you are an alumni, we have once a month. We have an alumni-only meeting for our parents of our wilderness program. October 24th at 6:30 p.m. is that next offering. And then our intensive group have an online support group once a month. October 10th at 6 p.m. is that offering. That actually was tonight. So the next one is November 7th. Go to our website at evoketherapy.com/family involvement for more information. If you would like to do a trek, a wilderness experience with your child or with a couple, our family trek option is that offering. Contact admissions@evoketherapy.com. Typically, it's 3 to 4 days, 2 to 3 nights long in the wilderness, psychotherapy with the same kind of experiential work that we do with our children in the wilderness. Wonderful experience. If you want a coach that's trained in this attachment work, we have a host of coaches available with a wide variety of experiences, and all have been exposed to and taught about this attachment-based therapy that I'm talking about tonight. Contact coaching@evoketherapy.com to get matched up with one of our parent coaches or our family or individual coaches. Like I said, we ask all current parents to try at least 6 12-step support groups. If you are averse to attending it and you are willing to take this invitation, you will learn what you're asking your child to do. You're modeling for them the very thing that you're making this great sacrifice and hoping that they will do. Al-Anon.org, CODA.org, FamiliesAnonymous.org, or AdultChildren.org. Also, RefugeRecovery.org or NAMI.org, the National Alliance on Mental Illness, have free classes and resources in your local communities. All of these broadcasts are available on Spotify or your favorite podcast app. Just search Finding You on Evoke Therapy Podcast. You can also go to SoundCloud.com on your computer and find us there. You can go to Evoke's YouTube channel and watch the rebroadcast of these video presentations there. You can find Evoke Therapy programs and me, Dr. Brad Reedy, on Twitter, Threads, and Instagram using the handle @Evoke Therapy and @Dr. Brad Reedy, respectively. I guess I should change the Twitter name to X. It's still hard for me to talk about it as X. Evoke Intensives is on Instagram using the handle @Evoke Therapy Intensives, and on Facebook you can find us by searching either Evoke Therapy Programs or Evoke Therapy Intensives. And of course, the Evoke Therapy blog has wonderful content each week. And the thing that I love and I'm so proud of in our program is that so much of what is shared is our staff and therapists' personal experience with the work, not some academic exercise or something that they want to teach you about that they have no experience with. If you want to give back to people that can't afford, for people that can't afford treatment, the 3 charitable partners that we work with and donate to include choosementalhealth.org, sky'sthelimitfund.org, and evokefamilyfoundation.org. My next broadcast will be October 17th next week. I'm going to be going to Austin, Texas for a couple of speaking engagements and parent support groups this week. So I'll be out there this week, the rest of this week. October 17th is my next offering, and that'll be a live Q&A. Any questions left over from tonight, any questions in between, you can always email us in between broadcasts at webinar@evoketherapy.com. Leave questions, suggestions, feedback, or stories there. All right, folks, I hope this was a helpful point of contact this evening. And for and on behalf of the people that you love and the people that love you, thank you for showing up and being willing to do your work. Have a great evening, and I'll talk to you next week. Take care. Bye-bye.